Have you ever wondered how often elderly people should shower? The answer might not be as simple as you think. Welcome to our in-depth look at the showering habits of the elderly. It's easy to assume that everyone should clean up daily, right? Today, we're lifting the veil on a common misconception and discovering the surprising truth about how often the elderly should shower. Stay tuned to uncover an unexpected secret that could change your perspective on hygiene and health. Most of us grew up believing that daily bathing was necessary, right? As common as your morning cup of coffee or the daily news. It's a ritual, a principle of cleanliness instilled in us from a young age. After all, who doesn't enjoy the refreshing feeling of stepping out of the shower, the tingling skin, and the scent of soap lingering in the air? This idea is deeply ingrained in our thoughts and society. It's a cultural norm that spans continents and countries, from bustling capitals like London and New York to quiet suburbs in Melbourne, across the rolling hills of the Scottish Highlands. The notion that daily showers are essential for personal cleanliness is as common as the sunrise. But there's a problem. This one-size-fits-all approach isn't necessarily ideal for everyone. Just as we all have different tastes in food, music, and fashion, our bodies require different types of self-care. And for the elderly, daily showers can be more of a hindrance than a help. You might be thinking, but cleanliness is essential for health. Yes, you're absolutely right. But let's take a step back and reevaluate. We might be confusing the ritual of regular showers with the actual need to maintain hygiene. What if I told you that frequent showers can strip your skin of vital oils, leaving it dry, irritated, and prone to infections? This can lead to a series of health issues for our elderly loved ones, whose skin is more fragile and dry. It's time to question this preconceived notion. It's time to consider that less might be more when it comes to showering, especially for the elderly. It's time to examine the research, studies, and uncomfortable truths hidden beneath this daily routine. But could this deeply ingrained idea be doing more harm than good? Let's find out. Let's see what the experts say about bathing, especially for the elderly. Shower frequency is more than just personal preference. Numerous studies have explored the potential effects of daily showers on the health of the elderly. One study led by the University of Pittsburgh revealed that the skin of elderly people is more susceptible to damage from frequent showers. Elderly skin is thinner and drier than that of younger adults. This dryness can lead to itching, cracks, and infections. Another study from the University of California, San Francisco, confirmed these findings. They discovered that repeated showers, especially hot ones, strip the skin of its natural oils. This can worsen dryness and cause xerosis, characterized by itching, flaking, and rough skin. The New England Journal of Medicine also examined this issue and found that elderly people who bathed less frequently had a lower incidence of skin tears. These are painful injuries that can take longer to heal in the elderly, increasing the risk of infection. But it's not just about skin health. According to the American Geriatric Society, daily baths can pose a safety risk for the elderly. Wet and slippery surfaces can lead to falls, which are a leading cause of injury among the elderly. Additionally, the Journal of the American Medical Association notes that showering can be physically demanding for some elderly individuals, causing fatigue and even breathing difficulties. It's important to note that these studies don't recommend that the elderly stop showering altogether. Cleanliness remains crucial for overall health and well-being. However, they suggest that showering daily might not be the best option for the elderly. So, what's the verdict? According to these findings, the elderly should balance personal hygiene with skin health protection, as well as the physical impact of showering. These studies suggest that the elderly might benefit from showering less frequently than daily, depending on their specific needs and health status. This could mean showering every other day, twice a week, or even less. These findings might seem surprising, especially in a society that often equates cleanliness with daily showers. However, it's essential to remember that everyone's body is unique, and what works for one person might not work for another. So, according to the research, daily showers might not be the best option for the elderly. But then, how often should they shower? In the next part, we'll delve deeper into this question. Stay tuned for the surprising reality of shower frequency for the elderly. Now, let's face the reality. Prepare yourself, as this might contradict what you've always believed to be true. Experts recommend that the elderly should shower only once or twice a week. Yes, you heard it right, once or twice a week. This recommendation, of course, depends on their level of physical activity and health status. Before you're surprised, consider the reasons behind this advice. As we age, our skin becomes thinner and less oily, making it drier and more prone to damage. Frequent showers can exacerbate this issue, leading to dryness, itching, and even infections. Additionally, many elderly individuals have limited mobility, making regular showering risky. Attempting to shower can increase the risk of falls and injuries in the bathroom, a commonplace for accidents among the elderly. Remember, our bodies have natural self-cleaning systems. Showering too frequently can disrupt these systems, removing the beneficial microorganisms our skin needs to function properly. There's also the matter of physical activity. Many elderly individuals don't engage in vigorous physical activity that causes heavy sweating, so they don't need to shower regularly. Conversely, those who remain physically active or have specific medical conditions might need to shower more frequently. So, there's no one-size-fits-all answer to how often the elderly should shower. Instead, it's about finding a balance between maintaining hygiene and respecting the body's natural functions, considering each person's health and lifestyle. Finally, perhaps the most unexpected truth is that our society's expectations and personal washing habits aren't necessarily aligned with what's best for our health. Surprised? Let's explore the reasons behind this advice in more detail. Join us in the next segment to delve deeper into these factors and provide some practical hygiene tips for the elderly. Why do experts recommend that the elderly shower less frequently? Let's examine the details. Our skin produces natural oils that act as a protective barrier, keeping it hydrated and healthy. With age, the production of these oils decreases, making the skin more prone to dryness and irritation. Dry skin can cause itching and discomfort, as well as more serious conditions like eczema. Showering too frequently can exacerbate these issues by stripping the skin of its natural oils. When the skin loses its natural moisture, it becomes damaged and more susceptible to infections. Therefore, the elderly should shower less frequently to help protect the skin's natural defenses and prevent problems. Now, let's talk about safety. Bathrooms, especially showers and bathtubs, can be hazardous environments. They are often slippery due to water and soap, and without proper safety measures, they can pose a fall risk. Elderly individuals who already have balance issues or physical limitations are at an even higher risk. According to a study by the Centers for Disease Control and Prevention, approximately one-third of adults aged 65 and older fall each year, and most of these incidents occur in the bathroom. By reducing the number of showers, we can lower the likelihood of these potentially dangerous and often fatal incidents. Lastly, frequent showers can exacerbate certain health issues. For example, individuals with respiratory problems might find that the humidity and heat of a shower make breathing more difficult. Additionally, those with arthritis might find the physical process of showering uncomfortable and exhausting. On the other hand, some elderly individuals might have health conditions that require a higher level of personal hygiene, such as incontinence. In these cases, alternative methods like sponge baths or wet wipes can be used to maintain skin cleanliness and avoid the risks associated with regular showering. It's essential to recognize that this advice isn't a one-size-fits-all approach. Shower frequency is primarily determined by an individual's lifestyle, health status, and personal preferences. It's always best to consult a healthcare professional to decide what's most appropriate and safe for each individual. Therefore, showering less frequently can be beneficial for the health and safety of the elderly. But how can they maintain good hygiene? We'll return to this topic in the next part, which will include practical hygiene suggestions for the elderly. Maintaining hygiene doesn't necessarily mean showering. This statement might raise a few eyebrows. However, it's essential to recognize that cleanliness isn't just about skincare. While cleanliness is important, so is health. And for the elderly, daily bathing can be more challenging than it seems. That's why we'll cover some alternative strategies for maintaining decent hygiene without showering daily. The first item on our list is the use of wet wipes. They're not just for babies. Adult wet wipes are an excellent way to freshen up without needing a full shower. They are gentle on the skin and can be used to clean the face, hands, and body. They're also convenient and portable, allowing you to use them anytime and anywhere. To avoid skin sensitivity, make sure to choose fragrance-free and hypoallergenic products. Now, let's talk about hand hygiene. Frequent hand washing is crucial for reducing the spread of bacteria and viruses. This basic yet effective method helps maintain cleanliness. Use warm water and soap to wash your hands thoroughly for at least 20 seconds, then dry them well. Also, keep hand sanitizer readily available in case water and soap aren't accessible. Don't forget about oral hygiene. Brush your teeth at least twice a day and use dental floss regularly. This helps prevent dental issues like cavities and gum disease, and it keeps your mouth feeling fresh and clean. Clothing hygiene is another factor to consider. Changing clothes periodically might seem obvious, but it's worth mentioning. Fresh clothes can help you feel cleaner and more comfortable. It's also recommended to change bed linens frequently to maintain a clean and fresh sleeping environment. Lastly, careful grooming can help maintain good hygiene. Keep your hair, nails, and beard, if you have one, clean and well-maintained. This can significantly impact how you feel about yourself. Remember, these are just some techniques for maintaining adequate cleanliness without needing to shower regularly. The goal is to establish a routine that works best for you and stick to it. Good hygiene involves much more than just cleaning. It's about taking care of your health and well-being, whether you shower daily or find other ways to stay clean. The key is to stay healthy and feel comfortable. It's clear that shower frequency isn't the most important aspect of hygiene. It's about developing a plan that considers your specific needs and situation and sticking to it. After all, cleanliness is a personal matter, and there's no one-size-fits-all solution. Let's recap what we've learned today. This journey began with a fascinating question. How often should the elderly shower? We explored the common myth that regular bathing is necessary for everyone, regardless of age. However, research reveals a different reality. The truth is, the elderly don't need to shower daily. In fact, daily showers can strip the skin of vital oils, leaving it dry and exposed. This surprising fact might contradict everything we've been taught about the importance of daily showers, but it's essential to understand it to preserve the health and comfort of our elderly loved ones. We also sought to understand why, with age, the skin becomes thinner and less oily. Daily showers can worsen this situation, leading to dryness, skin itching, and even infections. Showering every 2 or 3 days might be appropriate for the elderly. Finally, we covered various hygiene tips for the elderly, such as using gentle soap, moisturizing regularly, and washing vital areas like the face, armpits, and groin daily, even if a full shower isn't taken. Remember, maintaining your hygiene is more important than how often you shower. Stay clean and healthy. It's clear that shower frequency isn't the most important aspect of hygiene. It's about developing a plan that considers your specific needs and situation and sticking to it. After all, cleanliness is a personal matter, and there's no one-size-fits-all solution. Let's recap what we've learned today. This journey began with a fascinating question. How often should the elderly shower? We explored the common myth that regular bathing is necessary for everyone, regardless of age. However, research reveals a different reality. The truth is, the elderly don't need to shower daily. In fact, daily showers can strip the skin of vital oils, leaving it dry and exposed. This surprising fact might contradict everything we've been taught about the importance of daily showers, but it's essential to understand it to preserve the health and comfort of our elderly loved ones. We also sought to understand why, with age, the skin becomes thinner and less oily. Daily showers can worsen this situation, leading to dryness, skin itching, and even infections. Showering every 2 or 3 days might be appropriate for the elderly. Finally, we covered various hygiene tips for the elderly, such as using gentle soap, moisturizing regularly, and washing vital areas like the face, armpits, and groin daily, even if a full shower isn't taken. Remember, maintaining your hygiene is more important than how often you shower. Stay clean and healthy.